This is Abuela Tomasa, and thank you for being with us again en tu programa What I Want to Be When I Grew Up. ¿Qué quiero ser cuando sea grande? Bueno, yo ya soy grande, pero ustedes, little ones, you start thinking right now. Y today, I have somebody special. Very, very, very special. Somebody who makes us smile. Exacto. Alguien que cuida de nuestros dientes. Sí. Ajá. Déjenme ver los míos aquí en la cámara. ¿Ah? A lo mejor tengo una basurilla. Bueno, sin más preámbulo, les voy a presentar a Dr. Miller. Dr. Miller, thank you so much for being with us. Dr. Miller is from Miller Dental. How you doing, doctor?
I'm doing very well, and thank you for having me this evening. I am so happy, and it's a privilege to be here to talk to you guys this evening.
Okay, perfecto. I have a couple questions because when the kids are little and young, they always want to know what they have to do. What are the steps to be maybe a dentist or an assistant or all those things that take care of our dientes. So here are a couple of questions for you so you can help us.
Okay.
The first one is, how old you were when you say, oh, I want to be a dentist? This is for me. yeah, I want to take care of this. I want to leave the people.
Well, that's a very, very good question. And actually, I found I want to be a dentist later on. I was in college, actually. But there were a few things that happened to me early on that made me start to think about dentistry. One was when I was 12 years old, I had an accident and I fell and I broke one of my front teeth. And for so long, for 5 years, I went because I could not afford to have my teeth fixed. And so I would walk around all through school with a big broken tooth. Okay?
Oh.
Yes. Yes. The second thing that happened was at that same time, I had an auntie who was a dental assistant. And the guy she used to work for, he used to send me books home about dentistry and about healthcare. Well, I was only in the 5th or 6th grade, and I really didn't understand, but I used to read those books a lot. There was no major internet, and the only thing we had were encyclopedias and books. So during my summer times and time when there was nothing to do, I would read about the body and healthcare. So those were the two things that kind of got me interested in dentistry. Another thing was my mother is a nurse. So I've been around healthcare all of my life. But dentistry came later. When I was in college, I wanted a summer job. And I went to a dental office and I saw a man. He was helping people. He was happy. His patients were happy. And I said, sign me up.
I want to be a dentist. Oh, nice. Okay, that is different because sometimes people, when they're little or younger, that's when they decide to study something. But that means your calling can come anytime in your life. You never know. Okay, yes. Here's a question that is going to help all these young people to decide if they want to be a dentist. What do you have to study? Because that's important. And how many years? Because sometimes people say, well, I like that, but maybe I prefer to have something short or something close to a dentist. Or what are my options?
That's a very, very good question. Now, when I was younger, I was a good student. So the first thing you have to be is you have to be a good student. I had to study a lot in elementary school, very important. Learning the basics of reading, writing, arithmetic, those things are very, very important. And then in middle school, things get a little more difficult when you do things like algebra and geometry and trigonometry. But the biggest thing is you have to study. So as I moved on, and in college, you do more and more. So I did my 12 years of school, and then I did 5 years of college because I changed my major in college. So we're going to do the math, guys. I did 12 years of school, elementary, middle school, high school. I did 5 years of college. That's 17. Then I did 4 years of dental school. Okay, it's 21, correct?
Yes, 21.
Then I did 3 more years of specialty school to treat children and to work on children in the hospital. So I did 24 years, but I did 12 years after high school. Now, there are different things in dentistry you can do. You can do dental hygiene, which will be 2 years to 4 years outside of high school, or you can do dental assisting. You can go to high school and then you can do dental assisting for 1 year. So those are the 3 areas of dentistry that a person can partake in. But you must finish high school, you must study hard, and do well in school.
Mm-hmm. Good. Well, there are options. If somebody don't want to do the 21 years like you did the study or the
24.
college for, well, they can choose to have something like 2 years or 4. And the assistant, there is just 1 year. They have an assistant. So there's just choices. Because sometimes people say, oh, 5 years, specialty, 2 more, 3 more. And then sometimes they just say, no, it's too much. But there are options. There are options. Okay.
Yes.
I have another question for you. Okay. What is the more satisfying thing that's been happening in your work that you say, well, this is why I choose to be a dentist. This is why I've been working so hard. What it is?
Very, very good question. And there's so many things that I love about dentistry. I absolutely love it. But the one thing that gives me the most satisfaction is when someone comes to you in pain, they come to you with something that's wrong, and you're able to fix it, and they see it, and they automatically start smiling. I told you the story that when I was in the 5th grade, and I was at 12 years old, 11 or 12 years old, I fell and broke my tooth. Well, I didn't get that tooth fixed for 5 years, until 5 years later, when I was in high school. So now, when a child comes to my office, they come there all the time. Someone's falling playing basketball. Someone's falling on a skateboard. Someone's falling from the bunk bed. Someone's falling, just playing, and they break their front tooth. Those kids come to me, and I gladly fix those teeth for them. And it's like they break the tooth on Monday. They come to me on Tuesday. I fix it, and they're so happy. And that is a big satisfaction for me because it took me 5 years to have my tooth fixed. So that's a big thing. And to see people who have no teeth to now have teeth is another thing.
Okay. Wow. Yeah, that is something else. I think that something that thing that happened to you with your teeth, that was really, really your calling. That's the thing that you say, I don't want another kid to happen the same thing like me. I think that was the thing that make you choose to be a dentist. Okay, I have another question.
It makes me more sensitive. It makes me more sensitive to people.
Exactly. I think that is important when you do something in healthcare to be sensitive with the patient. It's a person, not a ID number or something that, next. It's a person, and taking care of that person is satisfied. Okay,
Exactly.
that is fine. You like it. That's what I'm trying to say.
I love it.
Okay, here's another question for you. Okay, what would be the advice to give to somebody who's gonna try to go, follow your steps, trying to be a dentist? Or because I know there are different things between to be a dentist, as assistant, and all that. But if somebody wants to be a dentist, what would be your advice for that person?
Okay, so this is the first thing is, and it goes back to what I mentioned earlier. Throughout your schooling, try to do your very best and learn the most you can. That's number one. Because it doesn't matter things I learned in dental school, I have to reflect back to elementary school and middle school and high school. So education is very, very important. It's the key to things. If a person wants to go to dental school, they have to take some classes in college. They don't have to finish college, but they must take certain classes. Science classes are very important, and math classes are very important to take while in high school and in college. Those classes are needed to apply to dental school. So you take those courses or you finish college, then you apply to dental school, okay? And the acceptance into dental school is very, very hard, but you can do it. You can do it. There's an exam you must take. It's called the Dental Aptitude Test, or the DAT. You take that exam, and then that gives you a score, and you apply to dental school.
Okay.
Dental school then is 4 years. In dental school, there are 3 things that you mainly learn. Number 1, they test your knowledge. Okay. Number 2, they teach you how to work with your hands. The third thing they don't teach you, but you learn, is how to communicate with people. Those are the big 3 things in dental school. So that's how you become a dentist. Starting in your schooling now, going to college, taking the necessary classes, taking the exam to get into dental school, applying to dental school, and then getting in and then getting out of school. Those are the steps. But it starts right now in elementary, middle school, and high school to learn as much as you can and to really know it.
Mm-hmm. That is good what you're saying, because sometimes people say, well, I'm going to be this. I don't think I'm going to use math. I don't think I'm going to use science for what I want to be. So what you're saying is really good. They have to learn everything. The most they can, the better. So they have to learn. It doesn't matter. Maybe you're not going to be a dentist, but you still have to learn a lot so you can use it. Okay?
Exactly. It's a very good point, because in dentistry, was what we're talking about today, but in anything, take advantage of the time that you have in school now and learn as much as you can. Even if you stop after high school, that's fine. There are many careers in which you can go into and things you can do and to do very well. But it's about the person. It's about them learning. In the schooling that you're getting, take advantage of it. Take advantage of all the resources that you have in the school, all the resources that you have on the internet. All those things are very, very important, because we have a little time that we want to try to study. Yes, mine took 24 years to do, right? But that's okay. I loved it. It's not a problem. But right now, everyone has those 12 years of school. Take advantage of it.
Okay. Well, the time is running, and I have one last question for you, doctor, because I know you have to go back to your patient. I'm sure he's still waiting for you. Okay, the last question. How do you maintain, a balance between work and your family and life? Because sometimes people say, I don't want to study this because it's going to take too much time and I'm not going to have time for my family. Or I don't know if I really want to be away for this. So as a dentist, maybe many people is gonna think, I'm gonna spend a lot of time with patients, and I don't know if I'm gonna have time for a family. How do you balance that?
That's a very, very good question. Well, I am a father. I'm a single father, and I have 2 children, and I raised them. Well, my son lives with me. My daughter doesn't live with me, but I take care of my son. I cook, I clean, I do laundry, I do everything, okay? And also, I run the practice. I treat the patients, I go to surgery, I do the payroll, I do the insurance, I take care of the complaints.
Wait.
I
just got tired of everything you do. Oh my God, that's a lot. That's a lot. How you do it?
Well, this is how you do it. So to answer your question, it's called time management. And these are the things that you learn while in school. Everyone goes to school and they have classes for 45 minutes, and you do your work, and then you go to the next class, you do your homework, do that class, and then you go home, and then you set your time, you do your homework, you have dinner, you do your chores. See, all of these things you learn throughout life. And so now at this point, what I do is I'm able to work, and you work a certain time. It's a job, it's a career. And so you work from a certain time to a certain time. And then you do all you can do in that time, and then you go to your next job. And for me, my full-time job is being a father. So I go home and I pick my son up from school. I make dinner for him. He doesn't ask me to do any homework anymore. So, but I do, we do things around the home. And then, the next day you go take him to school. I go to work. I treat the patients, and you have to be very efficient and love. I love what I do. So it's not a work to me.
I think that's the point. When you love what you do, you don't feel like it's something hard, it's a punishment. You do it because you love it, because you like it. Okay. Doctor, thank you so much for your time. Muchas gracias. Thank you for being there, and thank you for taking care of my dientes right here. So, people, my little ones, mis amiguitos, if one day you decide to be a dentist, well, este es un buen ejemplo. Dr. Miller. If you need to see the dentist, bueno, ahí está Dr. Miller. Ellos hablan español, because abuela Tomasa no speak English too well. Ya se dieron cuenta, mi English is no good. Así es que, si usted, señor, do you take care of adults too, or just children?
Yeah. So we have a staff that half of my staff is bilingual. So we have English speakers, Spanish speakers, Arabic speakers. So we have all those, and for every child that we take care of, their parents also have the option to be patients of ours also. It is limited what we do, but we do take care of the parents of the kids who come to our office. We call it Mommy's Day. We do it twice a month.
Wow, there you go. If you want to go as a family, you can do it. Mommy, if you take your child, you can check your teeth too. Hay un cleaning quickly. Así es que again, gracias, thank you so much.
One more thing.
Okay.
Also about education. We also provide tutoring for children. Any patient that's a patient of ours, we have a tutoring program, and we provide free tutoring for them. Because I believe in education.
Okay. Ya escucharon, mamitas. Si usted no entendió, they have a program, un programa donde les ayudan a sus niños con las tareas. If you need help, si usted necesita que su niño le ayuden con el homework, porque a veces no sabemos, ellos le ayudan con la tarea. Así es que, si es paciente, you can use that, okay? Use it. Así es que, thank you again, and maybe we can have you in another time, doctor. Gracias, muchas
Anytime.
gracias. Okay? Bye,
Good night.
amigos. Next time. Thank you.
All right. Bye.